in my conversations with caregivers, they've for the last couple months just really been consumed with keeping everyone in their house safe. And particularly it's a weighty responsibility to keep children safe. And this is all very unknown, and there's guidelines changing every day, it seems like. And so there's just a lot of responsibility felt by caregivers to keep everybody safe. And so what we have kind of been told, all of us in the world in the last couple months, is stay home, stay away from everybody, and that's how you stay safe. And so I think it's fear of getting COVID, fear of a high-risk family member getting COVID, that kind of thing. I don't know, Jason, what do you think parents are feeling right now?
Well, so I've noticed the tide shift from the beginning of COVID and the first suspension of in-person visits until the last, say, like 2-3 weeks. The tide is really shifted from like, I understand, I don't support not being able to see my kid, but I understand for like safety and like keeping kids safe, right? And keeping my kids safe, and like I don't want to get COVID, and like they didn't want the exposure, right? And I think that what was hard for some families is when you have things that mirror like how the governor didn't suspend parenting plan visitation between parents and children. And you had some parents that were on that type of visitation that mirrored what parenting plan stuff kind of looked like. And so that was confusing and frustrating. And then stuff with like family member visitation, where like grandma or auntie were supervising the visits or facilitating visitation. And that was stopped when people were within the same households, both are self-quarantining. The only travel is like over to the house for visits, right? And like we can't do that, and like parents were frustrated with that. What it's transitioned into now is a lot of like anger and confusion because the world is kind of opening up. You can see it on the news. There's protests in the streets. There's coffee stands that have never closed. There's, I had one parent say, if bikini baristas are essential, then visiting my child is essential.
Shannon, what are social workers feeling right now?
I think that there's a lot of trying to navigate the unknown, right? Because everyone looks to us to be the decision makers and to know what's going on. We're expected to have answers to people's questions. And we exist right now in a time where we don't have the answers. There was no training in our core training for what to do if there's a pandemic, or, what to do if there's a public health crisis. Like that was not part of our training. And so we're being looked to have answers, but we feel a little bit helpless that we don't have those answers. We don't have a magic bullet to make things safe for everybody in a way that we want to. We're absolutely committed to ensuring the safety of the children and the families, and we don't want anyone to get sick, just like you guys have talked about. We don't want to make a decision that causes or indirectly causes somebody to end up ill, or horrible as it could be to be in the hospital or even pass away. Like we don't want to make a decision that could put somebody in that position. But we also absolutely recognize that parents and kids have got to see each other. It's essential. Like that, talk about essential, that is essential.
Yeah.
And so we are in a position where we have to balance these things. And then as things, like you said, Jason, have started to ease up in terms of things are starting to open and we're getting some more permission to start going back to in-person visits. And then we're trying to arrange logistics and figure out, well, what are all the things that need to be in place? How do we actually make sure that this is as safe as possible? And, the state has ordered as many supplies as they can possibly try to order, and yet we still find that there are times where we don't have the supplies that we need because there are just supply chain issues, right? And we feel guilty and worried that we can't provide the supplies, and that could be one of the reasons why visits can't go forward, because we don't have the availability of supplies that we would like to have. You know, we also find ourselves trying to support families who are dealing with crises upon crises, because we're dealing with caregivers and placements who normally are very stable and now maybe have lost jobs, and those homes and those placements are not stable. So we're not only worried about the safety in terms of COVID and worried about keeping the connections to families, you know, parents and children, but now we're also worried about losing placements because of maybe financial issues or other limitations that have come about because of COVID. And so we're trying so hard to support everybody and balance all of these things. And I think sometimes we just feel a little like helpless, you know, like we don't quite know how to do this, right? Like what are we supposed to do, and who do we look to for guidance? Because just as much as we didn't get training for this, you can't go to a supervisor and say, hey, what did you do last time there was a pandemic? Even your AA, or, you know, like nobody has experience with this. And so it's not something we were prepared for, which is really hard.